registration applications with Denise over there. So after the talk, if you haven't registered to vote, please do so with Denise. She'll help you out. And then, of course, we have our Great Valley Museum and everything is going over there. And I will not take any more of your time. So let's get started.
And actually, this is our time. So please. Thank you for that intro. I appreciate it.
Yeah. And then
all right. Thank you. There we go.
Okay.
All right. I thank you. And I just first want to start off by saying there's other esteemed people in the room as well. Bonnie, Dr. Hunt is in the respiratory director. We'll probably reel her in to talk a little bit about the program, but she said no. But her students are here. I think, who's a respiratory student right now or a medical terminology student? Yes. Okay, perfect. So we have students in here. I know that we have students from programs in here. So we have two RN students. They're in our current ADN program. We're going to be talking about that program as well as others. But to be student-centered, I'm going to start with them, if that's okay. That's where I like to start, is to highlight all the students, including you guys. So Adam, if you want to start, and Adam's here to kind of share about his experience in the ADM program. And yeah.
How are we doing? Are you all looking to be maybe RN, CNA? How many of you want to be an RN? Okay, and how many of you want to do CNA? Now we're all here for everybody's RN. Anybody for RT? For everybody's just
awesome.
Woo, woo. All right. Well, like I said, my name's Adam. I'm a second semester student here, also with Ronnie. Ronnie's a second semester student with me. So I started in January of this year. My journey, I think, began many, many years ago in healthcare, working at an optometry office. And that's kind of where I first got my intro into healthcare. It's not as hands-on as an acute care setting like a hospital, but it was kind of the first time I was able to talk to a patient and realize that kind of was really cool. Talking to patients every day and getting to help them in some capacity. Puttered around, figuring out what I wanted to do. I've worked in customer service, now I'm a server, so that's my night gig right now as I'm in the program. So again, still working with people, just in a different capacity. I did all of my prereqs at Merced College. Merced. We love MJC. We love MJC, but
that's okay.
We can rep Merced a little bit.
Yeah.
And I did all my prerequisites there, cast out my net just to kind of figure out where I wanted to go. And I was very, very lucky and pleased to get accepted to the Modesto Junior College RN program. I know some of you are, and is anybody in LVN? Nobody's okay. There's different routes you can go, obviously. Some people want to go LVN first. I chose to do RN. That just kind of was my end goal. So I just said, let's just shoot for the stars, why not try to do what I want to do from the get-go? And it kind of worked out. It's been an amazing journey. I know when I was in your seat, it can seem intimidating to get in, to get accepted, to get those A's. It's a really hard, long process, and pat yourselves on the back for wanting to do something that's so difficult, because it really is difficult. But once you get there, everybody at that program is so nurturing, wanting you to succeed. They want to make you good nurses. They want to make you the best you can be. And so just try to take the anxiety down a notch. Everybody wants to make you be the best that you can be. And it really is a wonderful, wonderful program with all of the resources they have. All the instructors are so nice, so wonderful. They care about you, and they take the time to make sure that every student is taken care of. We're not just a class. Everybody is. It's the same way that we're patient-centered. They're taking care of us one-on-one as well. So I think there's tremendous value in that.
Thank you, Adam. That's amazing. So yeah. And it takes a lot to stand here and talk about your story. I'm hoping one of you one day will be standing here and I'll say, hey, he was just in class. And I said, hey, you want to talk? He's like, about what? And I told him and I told him. But the reason why is he also represents leadership. So within each of our cohorts, we pick somebody, they self-select as a class who can represent them in our faculty meetings, as a student voice. And I encourage you guys always to participate in your journey actively. And so if there's some concern along the way, he's the voice for his cohort of students. So thank you for being a leader, an example. We appreciate you. Go enjoy the day. I know you're, yes. So I'm kind of off, know the title, he's a nurse, is a nurse, right? I also am going to talk about all of the programs that we partner with, because as a nurse, we're never alone. We always are in a team. In fact, I can't do what I do without others. And that's why I'm not giving this presentation alone. I'm giving it with students, other directors, with you in mind. But ask the question, and I want to see what kind of answers you can give me. What makes a great nurse? And I don't know if you've used Slido before, but if you can get your phone, that's a QR code. Tell me what makes a great nurse. I'll go into kind of an intro to what I'll talk about here. And when the answers pop up, as they get larger as a word, more of you are answering the same way. Is it working? Yes. Okay, good. So I know of you are aspirating to be in healthcare. I'm here representing nursing, but there's a plethora of positions that are in between. And maybe the end journey is on our end, but you could be many things along the way. So I'll just tell you, I started out as a medical assistant and I loved it. While I went to college, I worked in clinics. I got to know the doctors, the nurse practitioner that worked there. And I got to see, my mom is also a nurse and I'm with a Filipino background. And typically that's, our culture loves to promote nursing. And that's just something active in our culture. If you're Filipino and you're female, you're going to be asked to be a nurse in our family, which is amazing. Yes? Oh, high five. Oh, Juan's giving me a high five. Oh, well, yes. And so look at that. You guys are saying, and I'm glad this is a because it, in the center of that word is passion, and you do have to be passionate about what you do to affect someone's healthcare. And it really, too, the second most biggest one is caring. And that's where the center of all this, it literally is in the word healthcare worker. Care is the center of that. And that is caring for others' health, being a partner with them in their health journey. And that just doesn't start with you in a program. You can start that now. You can be advocates for health now. Your family and your choices are being affected by what you do and now. So you could I also have a colleague here that's going to share her journey a little bit. Professor and Director Robinson here is going to talk a little bit more about her CNA journey, but do you want to do a little intro? Yeah.
You gotta come closer.
Sure. Oh, sure. Okay.
No worries, don't take it off.
Yeah.
Good afternoon, I am Tanya Robinson. I am the Nursing Assistant Program Director here at Modesto Junior College. And I started out in my journey as a nurse assistant, certified nurse assistant. I literally did that for 15 years. And then I decided to go back to school, became an LVN, and I worked as an LVN 11 years. And then decided to get my ADN, my RN, and I've been an RN now for about 12 or 13 years. So literally, I have spent my entire career taking care of other people. And this selfless career that I have chosen has been more rewarding to me, I think, than I could have ever been to any of my patients that I've cared for. I haven't had bedside care in, I don't know, probably about 3 years now, where I've been doing direct bedside care. I haven't done that in a long time, but I think I've put in the time. I think I've done it a lot. And so I now want to make sure that I'm raising and training the next generation of healthcare providers, right? So that if I'm ever in the hospital and a nurse comes into, she already knows. How many CNA students do I have? Do I have any? Oh, I have a couple. Okay. Nobody raised their hand to be a CNA, but trust me, I've had students come through. And when I tell them in the class, when I'm training them, I want to teach you to care for people and to be kind and empathetic. I said, and if I'm ever a patient in a hospital and you walk in the door, I don't want to have to put up a, right? Because right? I want you to say, oh, I'm so glad you're here. Come on in, help me feel better. Okay, so it's a wonderful profession. I've enjoyed my time as a nurse. And I totally enjoy educating students and just pouring into them, out of me, into them, what I know it takes to be a good nurse.
And I do love that she put that quote there by Maya Angelou, because I frequently will borrow from that. You know, if sometimes they won't remember your name or what you taught them, but they certainly will remember how it
made them feel.
Yeah.
They'll never forget how it made them feel.
Yeah.
And I love Maya. And I think it's important that we not only like ourselves, but we actually like what we do and we like the way we do it, right? As nurses, if I can, at the end of every day, after I leave my patients, I want them to be in a better position and in better shape than they were when I came, right? I always want to leave them doing better. So it's important.
Thank you.
All right.
And I think we're going to share too a little bit about the programs themselves. I'll leave a link to a video. It tells a little bit more about my journey. I started off, like I said, as an MA. I became an LVN, worked as an LVN for several years, and then became an RN, and then finally became an FNP. So I'm family nurse practitioner. I see from 0 to 99 at the clinic, and it's very rewarding. My mom is excited that I ended up choosing nursing. I wanted to go a different path, and I was led here. So something led you here today. So hopefully you'll pull out something from this presentation that will help you on your journey. In terms of programs, and I do want to highlight that we have several that are here and represented. CNA is really the center of the pathway of our programs. From us getting your CNA certificate, you can get led into the other programs that we offer. So, and if you go into the ADN program, the first course that we teach in the first semester really is covering the similar or same content as a CNA program would. We do have also a respiratory therapy program. And that program is highlighted for our campus, for a lot of community college campuses, because we offer a bachelor's of science at a community college. And I just want to pause there, and I honestly want to give congratulations to our director, because that is not an easy feat. That took a lot of work. So I'm very proud of saying that about our allied healthcare, about our community college, because it really is a star Normally, you would go on to a four-year university to acquire that, and you could do it right here for a lot less. But it's a lot more in terms of, and we'll go over, what you would make in that position, how long things are. Imaging, does anybody want to be an ultrasound tech or rad tech? Yeah, that's popular. And so we're looking to develop that program, hopefully in the near future. We do have a medical assisting program. Medical assistants usually work in clinics, and as opposed to CNAs working in long-term care and the hospital. So we'll talk a little bit about that program. We don't currently have physical therapy or occupational therapy. It's in development, as well as the LVN. So the assistant, yes. So licensed vocational nurse is also being developed. That's probably why I'm balding, because we have to write the curriculum. There's going to be 18 courses that have to be written and perfected before we launch that out. But you could see that we've kind of purposefully done the CNA at the center of that. This QR code is for our health professions link, and that will take you to our website. And if we have time in the end, I'll kind of take you a tour of that website so you can see how to get more information. I'm going to bring Tanya back on and to talk a little bit about the CNA program. You sure?
Yes.
Yeah, I think.
Okay.
Yeah, I'll just give it to you. All right. Right. Okay.
All right, I'll hold it here so I can pass it back. Can you pick me up okay? Okay, great. All right, I'm just going to give you a little information about the Certified Nursing Assistant program that is offered here at Modesto Junior College. The length of the program, we actually have 16-week program. That's the entire semester, and it is offered in person. And we offer it in the fall and spring of every year. We also have a 7-week program, and the 7-week program is offered twice a year, twice a semester. We have it hybrid synchronous, which means the theory portion is online, but you must sign in at a specific time for live lectures. And we offer that in the fall, spring, and summer. Salary now for our nursing assistants starting out after you complete either the 16-week program or the 7-week program, you take your state certification exam and you get your first job. It starts out between $20 and $25 an hour, depending on where you work. And that is for the Stanislaus County area. Your responsibilities. So as a certified nursing assistant, you could be working in long-term care, in skilled nursing facilities, or in a rehab facility. You are also hired in acute care settings like Memorial Hospital or Doctors Hospital or Emmanuel. They are also hiring certified nursing assistants. My CNAs are the front line. You are the person that's providing that direct patient care. A lot of the work that our CNAs do include activities of daily living, which is bathing, assisting with dressing, assisting with meals, gathering vital signs and helping with exercise and physical therapy. That's your responsibility. I think as a nurse assistant, you must be caring, you must be dependable, have good basic work ethics, have soft skills where you show up to work on time. When you get there, you're ready to work, just those basic soft skills. And then you should possess professional conduct. So you're going to be professional in your actions and how you work, and not only working as a team member, but also how you care for the residents and the patients that are in your charge. Oh, do we want to show the video? Move on?
We have time.
Okay. I meant move on. There we go. And Oh, there we go. Now, certified medical assisting program. Anybody want to be a certified medical assistant by a show of hands? Oh, one person, yeah, show. Be proud of that. Hold that, throw that arm up in the air. Yeah. All right. So we also offer a CMA program here at Modesto Junior College, and it's the Certified Medical Assisting Program. The length of the program, it is a 2-semester program with 1 semester of prerequisites. So with the medical assisting program, you can either do a certification where you just complete 1 year and you become certified, or you can do 2 years where you earn your associate's degree as a certified medical assistant. Salary, it's the CNA salary, the same. It's $20 to $25 an hour. And that's after you've taken your state certification and actually passed it. Responsibilities, cross-trained in both administrative and in clinical skills. So as a certified medical assistant, they have what they call front office. And in front office, it's a lot of clerical work. It's a lot of filing, making appointments, billing Medicare or Medi-Cal. That is front office. And then they have back office, or the clinical portion, where they're taking care of the patients. They're weighing the patients when they come in. If they're there for a vaccine, they're giving that, administering that shot. So those are some of the things that you will do as a medical assistant. Characteristics, you have to be a multitasker, great communicator, dependable, just like with the nursing assistant, soft skills, show up to work on time, be prepared to work when you get there, that kind of thing, and pay close attention to detail. That's our CMA. All right, I'm almost afraid to click because I don't want to go. And I'm gonna try to move it on. All right, respiratory therapy. Now, although our respiratory therapist director is here, you're gonna trust me? Yes, all right. All right, do we have the students? Oh, yes. Come on. So in our respiratory therapy program, the length of the program, we have an associate's degree, 2-year program. Also, we have a bachelor's degree program offered here as well, and it's only 15 months. The salary is $77,000 a year, a little over $77,000 a year, and it's expected to increase by 13%. Your responsibilities: respiratory therapist, care for people with breathing disorders. I say that our respiratory therapists are our lifeline. They're keeping our patients breathing, right? If they're having problems, we're calling for Dr. Hunt and her team, right, to come in and do what they do. Characteristics of a good respiratory therapist: provide clear instructions and act assertively, to manage emotionally charged situations, communicate, and critically think. And you have to do that all at one time. Now, all of that is going on at one time. You don't have a chance to say, okay, let me do this and let me know. You have to do it all at one time, right? Sometimes both hands are going. You got an arm holding on to something, right? You got a foot holding something down, all at one time, right? Yeah, you have to be skilled at that. And we do. I don't think I have anything else.
I think you're.
I think I'm done. But we do have a student here that is going to share her experience as a respiratory therapist student. Oh, am I correct?
Danielle. Yes.
Danielle,
Nice to meet you.
hi,
Hi.
nice to meet you. Hold on, I'm gonna pass. Oh, thanks. Just a moment.
I could put her on top of my lungs.
There you go.
Of course. Hi, guys. My name is Danielle. Sorry if I am a little scrambled, but I'm a little bit of a yapper, so sorry. So I'm going to start off with how I actually found out about respiratory, because it's kind of a funny situation of actually how I ran into it. So I used to go to this place called the Modesto Camp. It's like a little workout place. And one of the people there, she was expressing interest in the nursing program. And I was also trying to get into the nursing program as well. And you'll hear that a lot, like nursing and respiratory, the kind of everyone switches from here and there. But I was on MJC, and getting information for her because I was looking up everything for it. And then I found another program called respiratory therapy. I did not know what respiratory therapy was, and not a lot of people do. And coming into this field and getting in, let me tell you, it was a big shell shock. I was like, wow, like this is a huge career field, as well as not a lot of people know about it. And that's why I'm actually here, because I feel like respiratory therapy is not really thought about a lot. And I actually, anyone who tells me about nursing, I'm like, well, what about respiratory? I always tell people about it because, like I said, no one really knows about it. And I actually had a patient family member tell me yesterday, like, wow, I didn't know respiratory did all of this. And it's true, like it's a lot. It is a lot. It's very mentally demanding, because critical thinking, honestly, huge thing. Critical thinking, it's something you have to keep on top of a lot of the times, especially when you're checking up on your patients in the ICU or even just on the floor. Patient assessment is number one. And let me tell you, I hold that to heart, and that's something I try to work on all the time. But yeah, so I ended up applying for respiratory, and I got into respiratory, and I was super ecstatic because I was like, yeah. Because I've always wanted to go into bedside. I always wanted to do bedside. If it wasn't nursing, if it wasn't respiratory, I was going to do speech language pathology. But I knew at the end of the day, I wanted to be at a patient's bedside, helping them feel better, or just honestly making them smile and making them feel like, they're my priority for that day. That's something I do every time. Like, I ask if they need water, even if that's not my, it's not that people say like that's not their duty or something, but I'm like, no, I want to make sure they have a blanket, they have water, they're okay, they don't need anything from me. Because, at the end of the day, I'm still on their service. And yeah. So yeah, respiratory therapist, we do deal with a lot of patients who have lung disorders, lung diseases, restrictive and obstructive. And we do a lot of breathing treatments. We help with intubation, extubation. We do what are called arterial blood gases. Basically helps you get your pH, your CO2, your bicarb, your PaO2, all the good stuff. And then you learn a lot about the body, like, cardiovascular, obviously the pulmonary system, you need to know all that. So yeah, I would definitely say, like, if you're a person that wants to work bedside and help your patient out and help them feel better, respiratory is also an amazing way to go. I have fallen in love with this field so much. I never knew I could enjoy something so much, and I'm learning every single day, even at clinicals. And I think that's something MJC is amazing for, is their clinicals. I hear a lot of other schools, I think they only get a 15-week rotation out of, I think, 2 years. At MJC, we're there every semester. And I think that's amazing, because all the hands-on experience that you get is, honestly, it's kind of insane of how much hands-on you get, especially still learning as a student. But every opportunity I get, I try to take it. And, I feel like MJC has given me tons of opportunities, and I want to jump on them as much as I can. And this was one of them. And I feel like respiratory therapy is amazing, and you guys should definitely look into it. I mean, nursing too, of course, and CNA and MA. But yeah, I have fallen in love with this field, and I think every one of you guys will too, especially if you want to be in the health ally. And yeah, thanks for listening to my little story.
I appreciate you.
Here. Mhm.
And just like I highlighted leadership with the RN students, she tutors and we pay it forward. So as you go on through semesters, you help others, and from a very intimate place how the struggle is. And it is that when you, with your cohort, you really do form a family with the people that you are are with. So thank you. I appreciate your time. And I just want to mention the reason why we kind of cross-reference respiratory with nursing is our prereqs are the same. And so there's an opportunity there. Our science background could be led into several programs. And that's going to lend nicely to also the LVN program that I'm imagining bringing to campus. This picture is here in the LVN program docket because this young lady here went to the LVN. We used to have an LVN program here, and it ended in 2009. And this young lady right here was the daughter of one of our graduates, is now one of the professors in our ADN program. This is Margie Humphreys, and her mom was the one that graduated as an LVN years ago here. So I always like to highlight MJC proud. Well, most of our instructors were former students. And that's because we believe in our programs. We like to graduate and pay it forward. So that's why I have fellow professors here. I also want to highlight we have counseling here. We have a success specialist that was behind the, where did Juan go? Juan was here, a success specialist. So it's, and our front office support specialist is also, she's like, Marlene, is it, hi, don't forget me. So why I highlight that is our team always is here to support. Oh, you're gonna do a talk? You wanna talk about our programs to students? I'm gonna be there, just in case they have questions, just in case they have interest. I wanna be able to clarify. And then like I said, I'm always student-centered. So the LVN program I have, you know, I'm proposing, and hopefully will come soon enough. That is, how many know what a licensed vocational nurse is? Okay, give me some thoughts. What do you think a licensed vocational nurse does? Yeah, at the VA, okay, at clinics. What else? Where else have you seen them? Nursing homes, right? So long-term care facilities. And so they call it a mid-level nursing provider. They are called nurses, and they are licensed. So here, our program will give you not an associate's degree at this point, but we're going to give you a certificate of achievement. And so after 5 terms, and terms are fall, spring, summer, fall, and then you'll graduate in spring, you're going to come out with an average salary of $51,000, which breaks out to about $25 to $31 an hour in this county, a little bit higher in San Joaquin County. We have a lot of responsibilities as an LVN. That's where I started kind of developing my skill as a baseline nurse. I gave medication as an LVN. In fact, at one point, I was 1 nurse to 40 patients. Ooh, I call that the In-N-Out burger nurse. You get a med, you get a med, you get a med, you get a med. And then I take lunch and then I do that again in the afternoon. And it is definitely, you do a patient assessment. Do you know what assessment is? You guys already do it. And if you're parents, any parents in this room? Yes, if you're a parent, you automatically do that. You scan the room. And you go up, and I see my daughter, and she has a little bit of Cheeto right here. I'm like, oh, so have you eaten dinner? No. Anything else? Yes. I had an apple. I'm like, apple with orange flakes, are you sure? So assessment is something you already do. We just enhance it. We enhance it with tools like stethoscopes, right? And then we get to hear what's inside the body, lungs, your bowel. Sometimes you hear it in each other. I heard some bowel sounds over here in the front row, right? Because you're so hungry. Patient education, delegation to the care team, right? So you work with CNAs on the floor in long-term care facilities. I say, hey, CNA, can you help me take some vital signs? Because I need to give some meds. What they do affects what I do, and we make sure that each other's safe. I'm always looking for my respiratory therapist. As a labor and delivery nurse, I could not do what I do safely without consulting a respiratory therapy nurse on, you know, the babies that are being born. and they might have breathing issues. That's the first person I call to say, hey, I got meconium, right? Or I'm sorry, I don't know that you don't know that term yet, but sometimes the baby poops inside the womb, and that is sometimes lodged into their lungs. So I have to, help with that, and they give them a better start as a baby. But delegation, we have to have great communication skills. And I was very shy. As somebody coming in, I was shaking as a nursing student. Hi, I'm Allison. I'm going to be your student nurse. And they're like, what did she say? And now I go in with confidence. And I'm going to be your nurse today. I'm going to take care of you and your family from this time to this time. And so you build your confidence as you go and you get your degrees. You have to multitask. You heard that in several other programs, is you have to be doing multiple things at once, and then you have to be a collaboration. You have to collaborate with a team. So if you're shy, you'll start that way, but we will allow you to grow in those skills. Okay. And then the good news is, and this used to be scary to people, technology friendly. No one even winced at the QR code. Everybody was like, oh yeah, I know QR code. Yeah, I know. Oh yeah, communication, compassion. You were already with technology. That's scary to some older nurses because technology could be hindering, but you guys probably already grew up with it and are very comfortable. But that helps be a supplement to our care, all the technology that we have to deal with. Okay. But here's the program that brought a lot of you here, I'm glad. Registered nursing. So what's the difference between getting it here and getting it at Stan State or getting it at a university? We take the same exact state licensure exam that every RN program takes. So we only, the difference is that you come out with a 2-year degree instead of at a university and you get a 4-year degree. The outlook is pretty good. In fact, students probably make more than me as a teacher coming out fresh, right? So 82 to 100, who wants to make $100,000 in here? Yeah, there should be more hands. She's, notice my hands up. Right? It's in Stanislaus County. Like I said, if you're in San Joaquin County, it's even more. Right? So depending on what type of nursing you do, your responsibility could be varied. Right? So I, for example, teach, but I also still work in the floor and I'm also in the clinic. Right? So there's plenty of places. You can work at schools, you can work in law. So nursing, there's a variety of settings that you could be and still have the same licensure, okay? But you're definitely a leader. And so that in all of these programs, you're gonna be developing your leadership skills. That's why we challenge students to be leaders and tutors and speak at these events, because we know that's gonna be a part of their job efficacy, how effective they are at their job. So great communication, teamwork, service-oriented. Okay, that means that you're there to serve your patients, your community. Okay. Let's see, what time do we have? I was going to take you a tour of the website, but you guys can do that on your own. I'm just going to take a peek. Here is our skills lab. If you've never been to Glacier Hall, it literally is around the corner. Okay, and we do open, at the last West event, we had open house. So any chance that you get where students aren't already in the skills lab, you can pop in and say, hi, I want to just take a peek at your skills lab. This is the actual mannequin. So we have like 24 beds with live active mannequins. We have a simulated hospital over there where I am the voice. Like today, I was in Columbia campus, and FYI, we're a satellite campus. So our RN program, we have a percentage that's here, but one cohort that's in Columbia College. And so we do simulation, which is we mock patients, and we have patients that cry. We even have a pediatric mannequin that follows you with its eyes. And screams and has sounds in them, so you can get the true patient experience. So
gave birth.
The one that gives birth. Yes, we have one that gives birth. Then we have a baby that comes out that is active. And respiratory also uses that in terms of giving you a true patient experience. So our website is the School of Health Professions. All of the programs that we were talking about today are listed here for you to learn more. Okay, so that's what that QR code is. All right, I'm going to leave this up here, but I want to open the forum to highlight you guys. I want to leave this ending thought is I'm so excited about the diversity of this room. It really is impressive. I'm so happy to see male. I'm so happy to see the ethnic diversity, the fact that this is jam-packed, because guess what? I'm not getting any younger. And you guys are going to have to take care of me at one point. So I want you to be able to come through programs that I trust, because when you take care of patients, and if you truly care for them, you treat them like you would treat your family. And in the programs, and you'll learn, we develop cohorts of families. I still talk to my nursing group and people that I went to nursing school with, because you do develop a bond, a trusted bond that they went through experience that is pretty powerful, difficult. So what questions can I answer? That's kind of the formal part of this. What brought you here? What can I answer in terms of your interests? And we'll try to do this. Do I pass them the mic? How does that work? I'll come close to you. Okay. Okay, sure. I'll repeat it. Yeah. Anybody have a question? Okay, oh yes, in the back. Travel nursing, yes. So once you get your RN license, there is I was talking about different areas of nursing. And one of them is you could travel as a nurse. So typically you work through an agency, and an agency places you in hospitals that need you. And there is bonuses, and depending on the agency, they will put you up in a place, and you have contracts that you sign that could be anywhere from a month to a year as a temporary kind of travel employee. And that's exciting. And I did that for a while. They gave packages to Lake Tahoe. They're like, do you want to ski? You could work 3 12-hour shifts. You could be in the lodge the other 6 days. I was like, yes, of course, sign me up. I was single, no, single. You didn't record that, did you record? But I mean, that was a way that and you know what I did? I learned so much from that. You know why? It's because you're dropped into a facility and you have to learn quickly, and you have to really be confident in your skills, because your onboarding is real small. So typically I wouldn't be a travel nurse unless you get, there's a nursing theorist says, from novice to expert takes 5 years of practice in whatever you do, especially in nursing. So I wouldn't recommend that. You doing that in the first 5 years, kind of wait till you build skill sets, and then you can go into any place and be like, I'm a nurse and I can nurse anywhere. The good thing about being a nurse in California is your license could travel to different states. Whereas if you were in the Midwest, I think you have to retake the NCLEX for you to work in other places. So that's the only downfall about traveling, is you have to make sure your license is compatible in other states. Good question. Any other questions? Yes.
Thank you for your presentation.
Oh, thank you. Oh, good.
I'm very interested in becoming a nurse educator.
Yes.
Like how?
Did you hear me? I was like, oh, you are getting me so excited, because excellent. So how do you become a nurse educator? I could do another hour on that. But really, any of these positions that you want to go into any of these programs, you're going to be an educator because you're going to be teaching how to be healthy. And you could start that today. You know, you just have to make sure the education that you're teaching is validated. So there's something that we practice called evidence-based, skills, is that what we do in these programs are being proven through research. Okay? We don't just tell you wear gloves just because we want to get rid of all our gloves. No. There is evidence that if you do wear gloves, that you're going to protect yourself and others from infection, right? What's the other big thing? And I'll get to your answer in just a second. What's another big thing? I'm going to just take this moment for talking about this, infection control, because we just got over a pandemic, right? What's another big thing to make, yes, say it loud, hand washing. That's a huge thing that you guys can start off right away. See, she already got her hand sanitizer out. I see you. She like, yeah, I already did it. Right? Because that's an easy way to keep each other healthy. So as a nurse educator, you do have to primarily get your nursing license. And then education usually requires a master's. So if you want to teach this, you have to get your master's. Typically it is in nursing, if you want to teach nursing. And then it is advanced degree. So you do have to get some years under your belt to be able to train and teach. There's educators that are at the hospital, and then there's educators based in academia. And it just depends on what kind of education you want to do. Typically, we orient new nurses, or in my case, we orient students to nursing and make sure that their practice is safe. So there's a lot of regulation, and that's where directors come into play. That's a lot of our job, is making sure that our programs are safe for you guys, that it contains the stuff that is supposed to be taught, and that it's relevant to what we're seeing in clinical practice. So I do want to highlight that all of our clinical sites are where some of our educators have worked and still do. So I'm still on the floor, and I want to make sure that my skills are still sharp so that I can teach from a very empathetic and knowledgeable place of how to do things, and not talk about a pump that I used in '85. Because they'll be like, that pump's not there anymore, and we don't do that anymore. Like, no, all of it is current because I just used it last week, right?
So Allison,
Yes.
AS Bachelor Master. I think.
Yes, so associate's degree, thank you, see counseling, partnering. You get your associate's degree as an RN, then you could, and thank you for mentioning that, we do partner with Stanislaus State. We have a bachelor's concurrent enrollment so that you could take bachelor's courses while you're in the ADN program, and then get your bachelor's within a year of graduation from our program. So there's that partnership we have with other colleges too. And then again, highlighting Bonnie is, and her program's bachelor's program for respiratory therapy. That's amazing. All right, quick questions with prizes. Which one of the programs, and first hand up is, B, you're gonna help me. Which one of the programs can you finish in as little as 7 weeks? Oh, that's not fair. You're in that program. Here. So I'm giving hot chocolate because it's almost fall, or I think it is already first day of fall. So I'm pretending it's cold, that you'll need that soon.
So it's 100 degrees.
Even though it's 100 degrees. All right. Which of the programs do you work primary in long-term care facilities?
RN,
An RN? You could.
young man,
LVN, I'll take that answer.
the green shirt. young man.
Yes? CNA, yes. LVN is CNA. So awesome. I'm sorry, young man, green shirt.
Young man, green shirt. Well, let's have him answer.
The next question, yes. Okay, the next question is, which one of the programs, who is this, LVN, CNA? Oh, can you pass that to her? See, my memory. You guys gotta hurry. My memory's gonna go. Which one of the programs offers a bachelor's degree? Yes, that's correct. And you're not an airhead. Hey, she's all, Danielle's all, yeah. All right, last question. Sorry. What is my last question? I wrote it down because I didn't remember it. What is it? See? Which one of these programs works in clinic settings? Yeah.
RN.
An RN, okay, I can take that answer. And a CMA, which is a medical assistant, so. Okay, I heard somebody say, LVN, that's true as well. We're typically in urgent cares. Okay, yes, thank you. All right, so I think I have about 5 more minutes for questions. Yes.
How often have you been sued by a patient?
Ooh, that's a good question. So, and I'll highlight, because it is, and I do appreciate, oh yeah, I'm so sorry. So one of the questions was, how many times have you been sued? Well, first, I can't disclose that because that's my personal business, but it is 0. But now you're gonna change my luck. No, but I do want to highlight 2 things. As a student, you have liability coverage from the college. And you're not working under, so if you're a future nurse educator, they're not working under your license. You're protected from what, if your students accidentally do a medication error. We do have to report it, but that's not under the nursing instructor's license. That's under the school. But you do carry you could carry student liability insurance, and then as you get progressive in your education, and as a nurse practitioner, I do have a big liability insurance. It's just a part of your practice to carry that for yourself. And I am in a role as a labor and delivery nurse in one of the more litigious areas. So surgery, pediatrics, labor and delivery, you can see why, because it's a very sensitive time in someone's life, and you're dealing with children and babies, and there's a lot of things that can go on. In fact, I'll highlight Redonda Vaught. Redonda Vaught was one of the nurses that did a med error that was almost put in prison because of it. VAUGHT. So I'll have you research that. And we do highlight that in the school because we take medication safety very seriously. And so there's extensive training and procedures that make you the safest on the floor. Okay, but we're humans and errors happen and we understand that. Okay, but we also take very protective measures, and so do our hospitals, to make sure that that training is extensive enough that we limit that. But don't let that scare you, okay? Because you could be a fry cook at McDonald's and be sued because you made the fries too hot, right? You guys know about that too, right? The lady's like, oh, I spilled coffee on myself and I got a burn. I didn't know it was gonna be hot, right? But now what happens? Look on the cup. It says contents are going to be hot, right? So we have to make sure, and I know in California, we're a litigious society, but don't let that deter you from going to healthcare, because there's plenty more instances where you're providing medications safely and getting our patients healthy than there is the instances where we would harm them. Good question though. What else? Yes, in the back.
COVID vaccine is needed to get into the program.
Okay, so someone asked, is the COVID vaccine needed to get into the program? And the answer is no, but if you work in a hospital facility that requires it and you need that clinical experience in order to get your licensure, then it's an indirect yes. Because We limit the amount of students based on how many clinical placements we can offer. And if it's at a place that requires that, then you have to be required that. Okay? But if in on admission and you say, I am not taking the COVID vaccine for whatever reason, the first thing I would do is ask why. Because a lot of what we do is, and the intent behind that is to protect the student. But there is instances where they cannot take it, and we will take that into individual account. That's where the directors come in and they have a discussion individually with the people, with the students applying. Yeah. So they're still being approved. Like I said, it's still a very new program, but one of the big ones is that you have to be a CNA with 1,000 hours under your belt. So you can't be just out of a CNA program. We want you to be on the floor. And then there's some courses, and I can't disclose that now because it's still being approved. In fact, as of last night, our curriculum is still being approved, yes.
1,000 hours.
Uh-huh.
What's that long?
You just have to be tiled as a CNA and prove through documentation that you've done 1,000 hours. That's an HHA, which you have to be a CNA to be in there. Yeah, absolutely. Absolutely, yes. Yes, and I'm glad that home health. So if you want to go into an industry that's not going away, geriatrics and gerontology and home health and public health are huge. So if you don't get into nursing or any of these programs, we're working on a public health degree, which is if you don't like needles, and there's some people that are like, I want to be a part of healthcare, but I don't want to be exposed to all the things like the blood, and I don't want to get the COVID vaccine. We could use you. We could use you in health education. We could use you at other instances where you won't have the exposure that's needed for that vaccination. So there's ways to get into healthcare and affect health. Epidemiology, for example, you study populations and what affects areas in health. I want to leave you with this, is that wherever you go, I want you to be healthy. Think about your heart in what you do. Follow your passion. I'm glad that compassion was the #1 word that came out of what you think of when you think of a great nurse or a great healthcare worker. So thank you guys. We appreciate your time. I'm happy to see such a full house. You are so bubbly. I love it.
Someone's gotta be bubbly.